I want to thank everyone for coming out. And on behalf of Governor Hogan, we have put together, that he initiated, the Emergency Task Force, Emergency Heroin Opioid Task Force. During the campaign over the last year or so, as we traveled throughout the state, and we would talk to various individuals, and particularly talking to law enforcement professionals and asking what were the big challenges that they were facing. It didn't matter what community we were in, but we were expecting to hear resources, budgets, equipment, vehicles, things of that nature, but we were hearing heroin's big issue. Didn't matter if we were in Caroline County on the Eastern Shore, Frederick County, St. Mary's County, we were hearing heroin. And the governor, candidate Hogan at the time, said that he was going to immediately pull together a group to address this. And what we're doing today, and what we'll continue to do for the next several months, is come out to communities, listen to what works, what hasn't worked, challenges that may be facing, get an understanding of the broader issue, and look at and try to come up with a holistic approach to resolving this challenge so that we can make recommendations to the governor. We'll issue an initial report this summer, but we'll have recommendations to the governor before the end of the year in terms of what steps we can take to address this particular concern. A lot of entities, state and local, have come to this issue from the standpoint of trying to address the overdose concerns. As most of you are probably aware, many of you are probably aware, last year, and it has been rising over the last several years, but the overdose rate, deaths from overdose of heroin, have exceeded the murder rate in the state. It exceeds the deaths in auto accidents in the state. So it is at a crisis level. And a lot of the approaches have been looking at trying to address that particular concern. We hope to have recommendations on that side, but also, as I said, a holistic approach. We have to look at prevention. Why are people moving in that direction? How can we address that concern? Basically stopping that pipeline. There's also treatment and recovery that has to be addressed as well. And then there is a law enforcement element. But as the sheriffs will tell you, as law enforcement will tell you, we can't arrest our way out of this problem. But we do have to address the trafficking and the bringing in of large quantities of this substance that is affecting our communities throughout the state. So I just want to, I took probably longer than I was supposed to.